Chapter 8 is on the topic of suicide, a difficult subject at best. I know that many of you have been touched by suicide or suicide attempts of friends, family, co-workers, or other important people in your lives, or you yourself might have thought about suicide. Virtually every human being on this planet has thought about suicide at one time or another. So if you have, it's not unusual. That being said, if you find this chapter brings up issues of suicide or other severe or even any mental distress, I would encourage you to reach out to either Robin King, our in-house counselor extraordinaire. I can promise you that she's wonderfully easy to talk to and non-judgmental and ever so competent. We also now, as of 2023, have an in-house counseling service online called My SSP. It's available 24 hours a day, 7 days a week, at no cost to you as part of your services at the college. And you'll see on the next slide how you would access it and some of the many topics and issues they might help you with. So if you need help, please reach out. There's no reason to suffer in silence. Support is out there, just waiting for you to reach out. Let's consider this quiz on suicide. Question number 1. Most suicides occur without warning signs. True or false? Consider your answer. It would be false. There are often, not always, but there are often or even usually warning signs. It would make sense that we should know these warning signs because they're warning signs. So take a moment and think what you could consider to be a warning sign. Consider a person that's maybe depressed. So it would have to be above and beyond depression symptoms. Or if a person has schizophrenia or a personality disorder, again, it's got to be above and beyond the symptoms of the disorder. So see what you can come up with. Take a moment. So reference to death and dying would all obviously be on the list. It could be vague, like, I'll miss doing that. And you think to yourself, we do that every week. It could be, I wish I was never born. I don't know how people go on. Life is useless and hopeless. So it can be very vague or it can be very direct, like, I should kill myself, I will kill myself. So anywhere on the continuum. Another warning sign would be engaging in risky, dangerous behavior. Another serious sign would be giving away one's possessions, especially one's prized possessions. Another warning sign would be unusual cleaning or organizing around the home. Why so? Making it easier for the person who would have to come on and clear and clean the apartment or home. And last one, often missed, rapidly improved mood when depressed. Most medications, as we learned, take weeks to work. Therapy also takes weeks to have a significant effect. So sudden rapid improvement in mood might suggest either the person's not depressed, maybe they're entering a mania phase, or why would they be feeling better? Looking forward to their suffering to stop, contemplating suicide. So that sudden drastic improvement in mood, definitely a disconcerting symptom. Number 3, most people who commit suicide leave a note. That would be false. It's a fairly small number, 10, maybe 15%, and yet some states require it to be clearly a suicide in order to be labeled a suicide. So probably the suicide rate is much higher than we suspect. Number 4, suicide is in the top 5 causes of death in the U.S. Thank goodness that's false. It's currently at number 10, which is still obviously very high. Next one, women attempt suicide more often than men. That is absolutely true. And the key word is attempt. So not complete to finality, to lethality, but women do attempt more often. Next one, teens and young adults are at the highest risk for suicide. I know that you're listening to sociology. You're saying, of course it's true, but it is not. Let me try to paint a profile of the person that's most at risk. This person would be a male person. He would be Caucasian. He would be over age 75. He would be newly alone through death. Maybe the partner is in a nursing home. Maybe the person has Alzheimer's, who's there physically but mentally is not. They often have expenses related to the person's death or illness or hospitalization or placement in a nursing home. They are also often sickly, perhaps prostate cancer, diabetes, what have you. So that would be the person that would be the highest risk. Of course, it can be any gender person. It could be any race or ethnicity. Even in any age, even children have completed suicide attempts to finality. Number 7, after a famous person commits suicide, there's often a temporary increase in the suicide rate. Yes, that is true. It also includes, for instance, say a high school or junior high school where you didn't even know the person. It's that person is modeling, unfortunately, a very undesirable behavior. So number 8, if someone talks or hints about suicide, not cause for worry. If they were truly serious, they would have already attempted it. Hopefully you're saying obviously false. Okay, number 9 then. If a depressed person has not mentioned it, not hinted about it, they are unlikely to attempt it. Again, hopefully obviously false. So if you find yourself worrying about somebody being suicidal, you're probably picking up cues. And you should probably address that by asking them, have they thought about hurting themselves or attempting suicide? Which gets us to the last one. It is dangerous to ask a depressed person if they're thinking about suicide. Many people are afraid that they will give them the idea. If they're depressed, they already have the idea. So you can ask them. If they say yes, you can say, that scares me. I don't know a lot about this, but we need to do something about this. If they're a college student, take them right down to the counseling area and say that you need an immediate appointment and explain why. If the person's not a student at the college, you have a number of options. You can call, if it's imminent, you can call a suicide helpline. You can get the person to go down to Ellis Hospital with you. You can call 911. You can help them make an appointment with a counselor, and with any counselor, they're always going to ask you, have you been contemplating self-harm? If they didn't, be on the phone with the person and say, my friend's contemplating self-harm or suicide. So do all you can do, because what if you don't because you're afraid and they do commit suicide? It's obviously not your fault, but still, you need to take every step that's reasonable to help them. And most people, once they get beyond that imminent suicidal state, never return to it. So it's well worth your effort. And again, if this particular side topic brings up feelings, you might want to make an appointment with our excellent counselor, Mrs. King, over in Student Services. As of the time that this narration was recorded, spring 2023, in the United States, suicide is the 12th leading cause of death. And this is actually slightly lower than it's been in recent years. And before I teach again, I will verify that this number is accurate and change if necessary. I'd like you to know the DSM-5-TR, the newest DSM, has a new category called suicidal behavior disorder. That is different than non-suicidal self-injury disorder, which is also new. Also, for virtually all mental illnesses mentioned in the DSM, they discuss a new heading called association with suicidal thoughts and behaviors for all disorders. So you might have to listen to that a couple times and read it a couple times. It's complex, but it's important for you to know. The next slide is a topic of suicide introduced to you in the form of a quiz. So answer the questions, don't stress on them, take your best guess, and then listen to the answers that will be found in the narration. This is a very, very important subject for you to know about. Let's consider some information related to guns and suicide and a couple general information points about guns. Guns are currently in the U.S. used in just over half of suicides, 56%. our suicide rate by gun is 10 times similar countries. Interestingly, 85%, and tragically by the way also, 85% of gun users die as compared to 5% of non-gun users. So this really indicates how bad it is to have a gun in the home. And you might say, well, they would just kill themselves by another means. No, not at all necessarily. Again, the survivability. And 90% of people who attempt suicide never die by suicide. So if the gun is there, it is eminently likely that there will be a lethality. But if that gun is not there, they have a much, much, much higher rate of survival, 95%, and are likely never to go on to be in that highly suicidal condition again. As an additional point not related to suicide that I just wanted to throw out, consider that guns in the home are also an imminent risk to children. Pictured as a 5-year-old boy that found the parent's gun and was killed. And if you're a parent, I would have never have thought to ask when I was allowing my child to play with another child, is there a gun in the house? Is it secured? An alarming number of guns are just in a bedroom nightstand or quote unquote hidden where the child knows they are, and that child could easily do a little show and tell with a gun with tragic results. So if you're a parent or a future parent, remember this slide, please. So we already learned that many, but not all suicidal persons do engage in common behaviors beforehand that could be a tip-off if you're aware of them. You noted before, interest or references to death and dying, engaging in risk behaviors, erratic driving, erratic drug use, just dangerous behavior that they don't normally do, giving away possessions, unusual cleaning or organizing of the home, and rapid improvement of mood when suffering from unipolar depression. So again, these are not all, but some warning signs that we should be aware of.